Hi, I'm Vicki Wessling with City Speaks. City Speaks is a show that's brought to you by Mayor Wilfred Rosas and his administration. City Speaks is here for you, the residents, to let you know what's happening in our community, in our city, in our surrounding areas. We also want to be able to bring to you things that are important, information about some of the services that are provided. And today we are so fortunate to have Hospice here with us and members of Hospice. So let me start. We have Dr. Layla Denoya. We have Dr. Tom Putnam. Dr. Putnam is the medical director for Hospice. We have Rachel Smith, our MSW, and Shauna Anderson, the president and CEO of Hospice. So Hospice is a thing that people think about, you know, what is hospice? What does it mean if I'm in hospice, if I have hospice care? Does that mean I'm dying? What exactly does it mean? And so I want to know a couple of things about it. We're going to ask some questions. It's going to be very conversational, so just jump in. So let me ask first, what is the mission of hospice? Can you explain it to me?
Hospice is a care system that we offer to people. It's not a location, but it's a group of caregivers who are there to address the needs of people with serious illness. And
Okay, so now when you say it's not a location, I know that hospice individuals, volunteers, they come into the home, but is there a facility that actually has hospice care at the facility?
Well, we do go into any place that our patient, whether they are at home or in an assisted living or a nursing home or sometimes in the hospital. In Chautauqua County, we don't have a hospice house.
Okay.
Although we would like to.
Right. Well, I know that coming from Florida, they did have a hospice house. And so I'm very familiar with that. And but so here in Chautauqua County, hospice would visit the patient or the family. And now you provide caregiver and family care as well. Is that correct, or counseling?
Absolutely. We provide the families with a lot of support, both in terms of the home health aides going in and providing hands-on care to their loved one, social worker that helps them with filling out forms, and just providing that extra emotional support and helping them network for services and supports in the community.
Right.
So that's a big part of what we do. Another part of what we do, besides providing care, is providing education. We do a lot of educating of other clinicians, healthcare professionals, and the community at large. It's not just that last few days. It's actually a benefit that's 6 months for people. So we have time to help them get their affairs in order and help their loved ones get ready for what's about to happen.
Okay, and I know that it's a very difficult time, especially for the caregivers and for the families. You know, of course, my father had hospice care in home. I have my brother who had hospice care in home. So I'm familiar with how difficult this might be. And so, you know, it's really appreciative to know that hospice is available in Chautauqua County. And I think a lot of people really aren't aware of that. Let me ask you up front, how do you contact hospice? Let me get that out of the way.
Well, anyone can call the office at 338-0033. Patients can actually refer themselves or a family member.
Okay.
We do always connect with their own primary care doctor to be part of the decision-making process to see if they're appropriate.
Right. So decision-making is really critical. All right, so let's get started. How does hospice care actually provide? What does it actually provide to the caregiver and as well as to the patient? What does it provide to us?
Let me mention that the originator of hospice in England came up with this idea of total pain, looking not only at physical symptoms of discomfort, nausea, but also social needs, financial needs, emotional suffering, spiritual questions of suffering. And so a big part of what we provide is a team of nurse, doctor, social work, and chaplain to address those different types of needs.
Okay, so actually, so it's really an interdisciplinary approach, right? It's one of the things that you really work with throughout over the entire spectrum, you know, from the emotional support all the way through to the physical needs as well.
And that team meets every week to discuss patients together and get the perspectives of each discipline.
Your team, does your team, are they outside of the hospice network? I mean, are there other members that would maybe come in to provide advice, provide counsel, or to provide input to the hospice network?
Sure, I think it's an approach with to meet those needs, like we said, an interdisciplinary approach, where we're trying to figure out what's most important to that specific person in this crucial time and pivotal moment in their lives. Using our medical social workers for the psychosocial needs, our spiritual care for that spirituality. It's the focus on comfort, feeling unburdened, but not making sure they're not burdening their family, as well as finding peace. And
before we go on to some of the other services that we provide, I wonder if Lila might be able to do some interpreting for our folks that perhaps don't understand Spanish or don't understand English as well.
Yeah, absolutely. And I'm sorry, I was remiss in not getting to you sooner, because Dr. Denoya is really here as a Spanish interpreter, because we have many non-English speaking people in the area. And so, Dr. Denoya, I'm going to let you go ahead.
Oh, thank you so much. Sí, Hospice es una organización muy importante en la comunidad hispana. Es necesario que se sepa en qué consiste Hospice. En primer lugar, la misión de Hospice es dar educación, cuidado a la persona que realmente está enferma y que necesita un servicio médico completo. Tenemos la oficina de Hospice en dos lugares, en Fredonia, y la tenemos también en Lakewood, cerca de Jamestown. Son las oficinas donde el equipo se reúne. El equipo consiste de la directora del programa, el doctor Putnam, que es el encargado de la parte médica, toda la parte clínica del paciente y de los familiares. Y tenemos el servicio de trabajadora social, que ayuda mucho a la familia a todo lo que tenga que ver con los papeles de administración, como por ejemplo, si la persona que está enferma ha estado trabajando, necesita algún servicio de parte del trabajador social con respecto al trabajo, seguro, etcétera, la trabajadora social ofrece esos servicios. También tenemos una enfermera que va todas las semanas, una vez a la semana, a ver al paciente, ofrecerle la medicación, ofrecerle cualquier servicio que facilite y ayude a tener una mejor calidad de vida del paciente. Tenemos también la parte espiritual, que es muy importante. Tenemos al sacerdote o al pastor que puede ir y ofrecer ese apoyo espiritual que necesita muchas veces la familia y también necesita el paciente. Y tenemos los servicios de traducción o intérprete del inglés al español, porque tenemos muchas familias hispanas que no hablan el inglés, o si lo hablan de manera muy general. Sin embargo, es muy importante que cuando nosotros vamos y visitamos a la familia y al paciente, estén claras las instrucciones que da el doctor, que da la enfermera, que da el pastor en el momento dado, y también para hacer la conexión con la farmacia, con los equipos médicos que se ofrecen de una manera muy conveniente a la familia. Entonces tenemos un enfoque bastante amplio y de bastante beneficio para la comunidad hispana, que tiene que saber que existe Hospice para ayudarlos y ofrecerles el mejor servicio médico para el paciente.
Thank you.
You're welcome.
Thank you. Gracias. Right. That's great. And it is so important that we have you here. Thank you so much. That's really something that the audience, of course, and our residents need to hear. So tell me a little bit, what are some of the general requirements that one must meet in order to be considered a candidate for hospice or palliative care?
Hospice is a benefit provided by our government through Medicare, Medicaid, and almost all insurances. It does require that 2 doctors have to agree and sign a statement that if the illness continues as it has been, this person may have 6 months or less to live. Of course, doctors don't know how long people have to live, and we sometimes have people on hospice for 1 or 2 years or more. But that's the medical requirement to be in place.
Yeah, and and I know that to be a fact because my brother was on hospice for well over a year. And he had the hospice in-home care for well over a year. So just because somebody says you have 6 months to live may or may not be the case.
Right.
It could be less. So you have to have the two physicians have to pretty much be in sync with the diagnoses and the prognosis. Is that correct?
That's it.
Okay. And you were going to speak.
I was just going to say, unfortunately, the 1 year is the exception. Over 30% of the people that we take care of are gone in a week or less. And that's just tragic because you don't have time to get symptoms managed, you don't have time to get insurance set up for the family. There's a lot of things we can't do in a very short period of time. So it's wonderful if we have even 3, 4, 5 months to get everything situated, but that's not the norm, unfortunately.
And it's really sad to think that, of course, when people hear about, well, hospice has been called in, or they're now with hospice, the end is near. And so that that goes back to the caregivers. I mean, they're now struggling emotionally as well, and with what they need to do. So what kind of support do you give to the caregivers during this time?
Sure. Well, we like to come in, as we were saying, as early as possible. When you're facing a terminal diagnosis, it's inevitable that your life is going to change. Your family dynamics are going to change. Your goals are going to change, and your perspectives are going to change. And that's where we adapt with them, walking with them step by step, hand in hand, trying to make the easiest transition for them, to give them the resources to be able to make those needs met, whether it's in the home or in the nursing home or on occasion in the hospitals. In homes, we can bring in our own medical equipment, medications, supplies to make those changes more adaptable.
And we pay for those services as well.
So now say that you pay for the services as well?
We pay for the hospital bed, we pay for related medications and supplies if they're pertinent to their diagnosis and their care.
Now, if you pay for them, are you reimbursed by the insurance companies?
We get a flat rate to provide all services.
Okay, so it really isn't one of those things that you do itemization.
Correct.
Correct. Dr. Denoya, do you want to go?
Yes. Esta es una parte muy importante para la familia en general. ¿Cuáles son los requisitos para poder recibir los servicios médicos de hospice? Bueno, en primer lugar, el primer requisito es que el médico de la familia al paciente diga, bueno, realmente ya no podemos hacer más nada. Si tiene una enfermedad terminal como cáncer, por ejemplo, tenemos simplemente un periodo de 6 meses. Nadie sabe cuándo uno se va a morir, pero más o menos ese es un periodo, porque ya el médico considera de que el tratamiento que hasta ese momento le está dando al paciente ya no tiene más necesidad. Por lo tanto, en ese momento el médico hace la referencia al doctor Putnam, que es el médico encargado, le dice, tenemos un paciente terminal con cáncer y que realmente ya el hospital no puede ofrecer más servicios. Nosotros asumimos los servicios del paciente de la manera siguiente. Estando el paciente en su casa, se le envía la enfermera, se le envía para que le proporcione todo lo que se necesita. A veces tenemos casas que no tienen unas condiciones físicas apropiadas, como una cama de hospital. Eso lo ofrece hospice. no tenemos una silla de ruedas, eso lo ofrece Hospice. Y todo esto lo cubre Hospice a través de Medicaid, Medicare o el seguro personal, o lo paga Hospice. Es decir, no hay que preocuparse por la parte económica. Lo más importante es que el paciente reciba una calidad médica para que pueda tener una calidad de vida en los últimos meses de su vida, sea 6 meses, 1 año, pero eso es muy importante. Las personas que cuidan a un paciente con cáncer o que están muy enfermos se agotan. No hay tiempo para limpiar la casa, no hay tiempo para comprar, no hay tiempo para pagar los recibos. Hospice ofrece una persona que cubre los gastos del seguro, lo cubre Medicaid, lo cubre Medicare, inclusive el mismo Hospice, por 4 o 5 horas a la semana. Está con el paciente, mientras que uno, como el cuidador de esta persona, puede ir y hacer sus diligencias o cualquier otra necesidad que se tenga. Es decir, no queda sola la familia, nosotros le damos un apoyo completo. Entonces, volviendo e insisto, es importante utilizar Hospice al principio, no esperar cuando el paciente ya se está prácticamente falleciendo, porque se evita, no tienen todos estos servicios a la mano. Lo importante es contactarse con Hospice lo más pronto posible para que el paciente tenga una calidad de vida la mejor que se le puede dar, y Hospice tiene mucho entrenamiento, tiene una gran calidad profesional para dar esos servicios al paciente y la familia.
Gracias. I'll learn to say that correctly with the right roll of my tongue eventually. So we talk about someone coming in, so you have to have the 2 physicians, but can someone self-refer to Hospice? How do they go about doing that?
Again, just call the office number. We have an excellent intake nurse who spends a lot of time on the phone and explains things to family, explains about our programs, and then they contact the patient's personal physician to see if this is medically appropriate and set up an introductory visit. Sometimes a nurse and social worker can come out to answer questions even if the person doesn't sign on to the hospice care.
Okay, and we talk about payment. You have a volunteer network that helps, right, with hospice. Tell me a little bit about what kinds of volunteers do you have? What kind of criteria must they meet, and what are some of the responsibilities?
Volunteers are a core part of our services that we offer, and they are considered unpaid employees. So if you want to volunteer, there is an orientation that you go through, and you have to have medical clearance because we have to make sure that they're healthy before they're going out into the homes. We have volunteers that go out and work with patients. They might read mail, they might visit, they might read them the newspaper. We've had people who have cooked meals for them. They have done gardening for them. We have volunteers that work in the office or work with events. We have volunteers that actually do vigil with people at the end so that families can get out and have a meal, for example. The volunteer will stay with them so that they're not alone. And then we also got a grant from the Banfield Trust about 6 years ago for a pet program. So we have volunteers that take in canine good citizens. We also have a cat and some rabbits on occasion, and they do pet visits. And our volunteers in the pet program also will walk the dog, change the kitty litter. We provide food for people. We've taken animals to the vet if the person's no longer healthy enough to do that, and we do placement because some of the folks that we take care of, they're really concerned about what's going to happen to their pets when they're gone, and they sometimes like to see placement and where they're going, and that helps them to do the work that they have to do. So lots of opportunities for volunteers in many areas.
Now, and I think that that's something that people really don't think about, and certainly, I mean, I have a pet, and it would be, tragic to think, what are you going to do? So it's really good to know that there would be pet services to help. And also now, do you find that if you bring pets into the situation, into the environment, that helps the patient as well.
Absolutely. They do a lot of visits, mostly with dogs, but the response from people, that's a quality of life issue. And I would go back just quickly to the services that we offer along those same lines. Besides what's on our license, we also provide massage therapy and Reiki and music therapy and art appreciation, because they're not reimbursed, but those are quality of life, and that's what makes life better. Whether you are looking at a week or a month or 6 months, you want every day to be the best that it can be, and those are things that help people enjoy the day.
Right. And that's important, your quality of life, to maintain some of those kinds of things that are really valuable and important to you. So the fact that hospice does provide that is really, that's really something that I don't think a lot of people think about. Typically, I think hospice is just, the physical side of things, but there really is more to it. So, shall we let you go?
Yep, I think that'd be good. Hay una parte muy importante de hospice, que no solamente los médicos se contactan con hospice. Cualquier persona que tenga en su familia alguien que tenga cáncer o una enfermedad terminal puede contactarse con hospice. El teléfono es, ¿cuál es el teléfono? 388
0033.
0033. Repito, 338. Gracias, doctor Prunem. 338-0033. Repito, 716-338-0033. Contáctese con hospice y en ese momento una enfermera toma la llamada telefónica y va informando y le dando respuestas de lo que usted necesita en cómo recibir los servicios de hospice, de manera tal de que no es necesario que sea solamente el médico. Usted puede tomar la iniciativa y hágalo, por favor. Es muy bueno para la familia, es muy bueno para el paciente. Bien, en ese sentido, tenemos también lo que se llaman los voluntarios, que son personas que ofrecen su tiempo de una manera bastante cariñosa y con bastante compasión hacia la familia y hacia el paciente. Por ejemplo, los voluntarios que no son pagos, se ofrecen su tiempo, están en diferentes áreas. Pueden acompañar a la familia, pueden acompañar al paciente leyéndole un libro o poniendo una música, o puede ser que el paciente cuando estaba y se sentía bien tenía un perro al cual él o ella quiere mucho. Nosotros también ofrecemos ese cuidado hasta el perro, cuidarle el perro al paciente, llevándolo al veterinario, dándole la comida, sacándolo afuera, porque para el paciente es importante también su mascota, y la mascota es muy importante en la vida de un paciente, así que eso también se ofrece. Y es muy importante que todo esto tenga que ver con la calidad de vida que se le quiere ofrecer al paciente en esos 6 meses o el tiempo que Dios disponga, porque nosotros no sabemos cuándo nos vamos a morir. Sabemos que estamos enfermos, sabemos que tenemos una enfermedad terminal, pero no sabemos cuándo. De allí que es muy importante que se contacten con hospice de una manera temprana para darle al paciente una mejor calidad de vida, que es lo más importante. Repito el teléfono, 716-338-0033.
Okay, thank you. That's great, yes. Now let's say the number to call for the English speaking is
338-0033.
338-0033. So that's critical. So if you have a question, if you need to get more information, that's the number to call. So that's something that we really do need to know. And we'll also put that up on the screen. This particular segment is going to begin airing on Thursday, November the 7th, and will air for the full week. We're going to start the second half of the segment that will air the following week. So just to let people know that we're not going to end this week. We're going to continue on. So let's talk a little bit. We have some things that we need to think about. The caregivers, you know, and I always think about that because I know that, you know, being involved as a part of that process, the caregiver needs to have care as well. So you talk about respite service, if you will, that you come in, you have somebody to stay with the patient so that the caregiver can go out, maybe to dinner or to a movie or to relax for a few minutes. Do you also provide any kind of social or emotional support for the caregiver?
Yes, I think that comes a lot from the whole interdisciplinary team as a full, but also with the spiritual care needs as well as the social work needs, to do the psychosocial assessments and kind of meeting people where they're at and adjusting as they're adjusting. It's really imperative. A primary focus a lot of times for our patients is their concern about burdening their family and ensuring that they have that respite and the support that they need to go through this transition with them. So we have a primary focus on providing that support to the caregivers and providing that education to normalize the changes they're observing and to help them not to accept but to reframe their sense of hope. And focus on what their goals are to that specific individual and that family. We do have resources that we utilize. We have a lot of books that come with the admission packet. Caregiver Confidence is a huge one. Providing, you know, education to the caregivers on how to care for somebody at home, but also to avoid caregiver burnout, which is very, very common because it is a stressful situation and it can be very overwhelming.
Sure. Right, and they have to take care of themselves as well. So let you translate all of that for us.
Esta es una parte muy importante que tiene que ver con hospice y es qué apoyo se le da a las personas que cuidan al paciente. Porque uno cuando está cuidando a un paciente uno pone su tiempo y uno deja de lado muchas cosas. Entonces uno a veces siente que no puede ya más, que está cansado, que se siente que ya no puede atender más al paciente. No porque uno no quiera, sino porque uno está cansado. Un paciente requiere 24 horas de servicio. Hospice ofrece un servicio que es personas que pueden ayudarlo a uno. Si uno tiene la oportunidad, como miembro de la familia, irse a tomar un café afuera, porque uno está tan presionado con los problemas de la salud, los problemas económicos, los problemas de la familia. Entonces uno puede salir, tomarse un café, encontrarse con una amiga o un amigo y realmente saber que hay alguien de hospice que viene a la casa, cuida al paciente mientras uno está afuera. Y eso es muy importante. También hospice, en esos momentos en que los miembros de la familia no saben qué hacer, esto cuándo va a terminar, cómo puedo manejar la angustia, cómo puedo manejar la tristeza, cómo puedo manejar el que mi familia, mi hermano, mi mamá o mi papá se está muriendo de cáncer. Tenemos profesionales en hospice que ofrecen apoyo psicológico y apoyo desde el punto de vista emocional. No queremos que se sientan solos. Es importante recibir ayuda y nosotras la podemos ofrecer. Hospice ofrece apoyo emocional y ofrece también apoyo espiritual. No quiero que se sientan solas las familias hispanas al saber que tienen una persona que está con cáncer y está en una fase terminal. Siéntanse que Hospice está aquí para ayudarles. Estamos 24 horas, 7 días a la semana. A cualquier hora pueden llamar. A las 2 de la mañana, a las 3 de la mañana, al teléfono que le dimos.
Okay, thank you so much. We're going to break now, and we're going to, in this particular segment, we're going to be back next week as a follow-up to finish the other half of the show. So thank you for watching City Speaks. You can watch City Speaks daily, 3 and 10 on Dunkirk Access 1301. Tune in to DunkirkAccess.com. Watch it on YouTube. Give me a call. Let me know what you think. 363-6888. Send an email, vwessling@cityofdunkirk.com. Snail mail me at Central 342 Central Avenue, Dunkirk 14048. And thank you, and we'll be back next week to finish the hospice conversation. Have a great day.